please stand up for me? I am noting if there's any masses, rashes, or lesions. Could you please lift up your pants and now turn around? Lift up. Masses, rashes, lesions. Okay, thank you. I'll now assess the temperature, moisture, and texture of the skin. Temperature, moisture, and texture. Temperature, moisture, and texture. Temperature, moisture, and texture. And I'll now assess the mobility and turgor by pulling, pinching, and releasing. Okay, you can have a seat for me, please, and lift up the bottoms of your feet. Okay, thank you. And I'll now assess the nails for any clubbing, brittleness, lines, lesions, or cyanosis. Okay. I'll now perform a head exam. I am inspecting the head and skull for the shape, size, contour, any deformities. I'm inspecting the scalp for hair texture, pattern of growth, nits, lice, or dandruff. I'm inspecting the face for symmetry, lesions, or swelling. I will now palpate the skull for deformities, contusions, or masses. I'll palpate the scalp for mobility and tenderness. I'll palpate the temporal arteries for pulsations and tenderness. I'll palpate the temporomandibular joint for crepitus. If you could open, please. Thank you. And tenderness and deformities. And I will palpate the parotid gland for tenderness. Okay. I will now perform an eye exam. I think so. I'm inspecting the eyes, the eyelashes, eyelids, and eyebrows for symmetry, arrhythmia, and lesions. I'm inspecting the eyelids for position and closure. I'm inspecting the lacrimal apparatus for any lesions or discharge. I will now palpate the lacrimal apparatus, and I will palpate the nasolacrimal duct, attempting to express any discharge. I will inspect the bulbar and pulpobar conjunctivae. You could look up and look down, looking for any injections or lesions. I'll inspect the sclera, looking for any injections or blood. I'll now perform a visual acuity test. We're going to measure this back here. And if you could please cover one eye and read the lowest line that you can.
5, 6, 3, 2, 9, 5.
Okay, you could cover the other eye, please.
5, 6, 3, 2, 9, 7.
Okay, you could do it with both eyes open.
5, 6, 3, 2, 9, 7.
Okay, I will now measure the pupil size. Okay, 6 millimeters. 6 millimeters, okay. I'll now test the visual fields by using Rose confrontation. If you could please have your arms like this and point when you see my fingers. Okay. I'll now assess the extraocular muscles by, if you could just follow the tip of this pen, please, with your eyes and not your head. Okay, now if you could look at a point behind me on the wall and then look at the pen when you see it in your vision. That was my test for accommodation. Now I will test for convergence. You could just follow the pen as it comes near your eyes. Okay, I will now test for lid lag. You can follow the pen as it comes down. Okay, I will now assess the tangential. I will now use tangential lighting to assess the cornea and the anterior chamber of the cornea, noting any crescent shadows on the medial aspect. Okay. Okay. I will now assess the pupillary reflex by doing direct and consensual pupillary reflex test. Direct, consensual by looking at the other one during the consensual. Direct. Okay. I would now dim the lights and perform my fundoscopic exam. Okay. I am noting the corneal light reflex for symmetry. I will now use my left hand and everything, and I will look for the red reflex before I move in. I'm noting the retinal arteries, veins, the cut to disc ratio, and the optic disc. If you could please look into the light. I'm noting the condition of the macula and fovea. I will now perform my ear exam. I'm inspecting the ear for any discharge or lesions or masses. Okay, inspection. Okay, I will now palpate the tragus, auricle, and mastoid for any tenderness. I will now pull the ear up and back as I insert my otoscope, using my pinky as a fulcrum. I'm noting the presence of cerumen, foreign bodies, or discharge lesions. I note that the tympanic membrane is a pearly gray, and I note the landmark structures of the tympanic membrane, which are the malleus, umbo, and cone of light. I'll repeat on the other side. Okay. I will also perform a whisper test at this time. So I'm going to cover one ear, and I'm going to say a word and tell me what I said.
Baseball?
Yes. Okay. I will now perform my oral exam. Okay. No, I'm going to perform my nose exam first, actually. I'm inspecting the nose for any deformities. If you could, I'll do a nasal patency test. If you could cover one nostril and breathe in and breathe out. Other nostril, breathe in, breathe out. Thank you. I'll palpate the nose for tenderness. Okay. I'll now inspect the nose. Okay. Using my pinky as a fulcrum. You could tilt your head back. Thank you. I'm noting the nasal mucosa that terminates for polyps and the nasal septum for any perforations or deviation. Okay. I will now palpate the frontal and maxillary sinuses. Okay. I will now perform my oral exam. You could open your mouth, please. Thank you. I'm inspecting the the buccal mucosa, the lips, the teeth, the gingiva, and the floor of the mouth. I am noting the pharynx and the condition of the tonsils. Sorry. If you could please say ah. I am noting the phonation and the symmetrical rise of the uvula and palate. If you could please stick your tongue out. I am noting that the tongue is protruding midline and the texture and color. If you could please stick out your tongue for me. Okay. I'm feeling for induration or masses. Also, on inspection of the mouth, I was looking for lesions or any masses. Okay, I'll now perform my neck exam. I'm assessing the neck for any lumps or areas of deformity. I'm assessing that the trachea is midline. And if you could please swallow for me, I'm assessing the function of the isthmus and thyroid glands. Now I'm going to assess the thyroid using my pinkies. And then here I'm going to displace the trachea to one side. You can swallow and palpate the thyroid. The other side swallow. Thank you. And the isthmus. Swallow, please. Thank you. Okay. I will now assess the lymph nodes. So I'm going to palpate the preauricle lymph nodes, the posterior auricle lymph nodes, the occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical. If you could please tilt to one side. Deep cervical, other side please. Deep cervical. And if you could take a deep breath. And supraclavicular.
Put your arm up like this on the table and bend your wrist forward. All right. Okay. Now can you up again and bend it backwards. Okay, put your arm flat on the table and go towards your pinky up. All right, now thumb in. Okay, so now I'm going to need you to make a fist for me. We're going to measure your MCP joint range of motion. Okay, now make a claw like this. Okay. Okay, so now we're going to look at the range of motion of your thumb. If you can put your arm like this on the table and make an L with your thumb. All right. Okay, now flat and make an L again. Okay, now bend your thumb for me. All right. Okay, you can relax. Now, okay, so now we're going to do manual muscle testing on your wrist. I want you to start with your palm up. Bring it towards you with your pinky out. All right, now hold it there. Don't let me move you. All right, now bring your thumb out. Okay, hold it there. Let me move you. All right, relax. So now, flat like this, pick your palm up. Okay. And then bring your pinky out. Alright, hold it there. Don't let me move you. Okay, now thumb. Hold it there. Don't let me move you. Okay, so you're gonna stay in that pose, and I want you to tuck and lean into it. All right, hold it there with your towards your thumb again. All right, hold it there. Don't let me move you. Okay, relax. Okay, so now we're gonna do the manual muscle testing of your wrist without the effects of gravity. I just want you to start with your arm like this, and then bend your palm forward. All right, now hold it there. Don't let me move you. Okay, hold it there. Don't let me move you. All right, now bring it back. And hold it there. Don't let me move you. Hold it there. Don't let me move you. Listen. Hold it there. Don't let me move you. Okay, great job. Okay, so now we're going to do manual muscle testing on your fingers. So first I want you to put your hands, all your fingers like this. All right. So hold it there. Don't let me move you. All right, hold it there. Don't let me move you. Hold it there. Don't let me move you. And now pinky, hold it there. Don't let me move you. Okay, so now I want you to pick this finger up for me. Hold it there. Don't let me move you. All right. Now this one. Hold it there. Don't let me move you. All right. This one. Hold it there. Let me move you. Okay. And pinky. Hold it there. Don't let me move you. Okay. Relax. Now, okay, so for this finger, I want you to just try to pick that tip up. Hold it there. Let me move you. Okay, good. Now this one, same thing. Hold it there. Okay, this one. All right, and pinky. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Okay. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Okay, so now I want you to do the longhorn sign. All right. Hold it there. Don't let me move you. Hold it there. Don't let me move you. Okay, so now we're going to look at your adductors and abductors. So first, start with your hand like this and try to move your first finger out. Hold it there. Don't let me move you. Okay, so now this one, try to kick it that way. Hold it there. Don't let me move you. Now bring that same finger the other direction. Just hold it there. Don't let me move you. Okay, now this one out. All right, hold it there. Don't let me move you. Okay, so now bring your palm up like this and hold your fingers together. I'm going to try to break them apart and you're going to hold them there. Okay. pinky. Can you put your arm like this and bring your pinky up? Hold there, don't let me move you. Okay, now touch it to your thumb. Hold it there, don't let me move you. All right, now palm down and kick your pinky out to the side. Hold it there, don't let me move you. Okay, so hold it there, don't let me move you. All right, now hold it there, don't let me move you. Okay. Now straighten your thumb for me. Yeah. Now hold it there, don't let me move you. All right, hold it there, keep it straight, and don't let me move you. Okay. So now, put all your fingers together like this, and I want you to hold your thumb to your hand. Don't let me pull it apart. Okay. So now, I want you to put your hand flat on the table. Kick your thumb out. Hold it there. Don't let me move you. All right, and like this. Pick your thumb up and hold it there. Don't let me move you. Thumb to pinky, and don't let me unroll you.
See if there's any lesions or any lumps, any scaling. At any point in time, if anything that I'm doing is causing pain or tenderness or you're uncomfortable, let me know. Okay, now I'm gonna go ahead and feel along your face. Press at your sinuses here. Do you have any pain?
No.
Okay, gonna feel down your nose. Any pain there?
No.
Tenderness?
No.
Okay. All right, I'm gonna go ahead and I'm going to look at your face for symmetry, even color, if there's any lesions or lumps. Then go ahead and look down your neck. And I'm gonna feel, okay. All right, now I'm gonna go ahead and feel your thyroid. So I'm gonna come behind. Now I am gonna press on your neck. I'm gonna press on the right here. I'm gonna have you tilt your head to the right and then swallow for me. Good. Okay, go ahead and relax. Now I'm gonna push to the left and tilt your head to the left and swallow. Good. Okay. I'm gonna take a listen to your temporal areas, along your neck for your carotid arteries, and then also on the front for against your thyroid for any bruise. Okay, I'm just gonna see if there's any thrills noted. Okay. All right, now I'm gonna go ahead and take a look at your eyes. First, I'm just gonna look at your eyebrows, your hair distribution, check your sclera. Will you look down for me? Okay, great. Okay, now I'm gonna go ahead and look in your left eye. If you want to take a peek over my shoulder while I do this. Okay, I'm going to look in your right eye. All right. Now, I'm going to go ahead and do a couple eye tests. This is going to test your vision. I'm going to hand you that. Go ahead and cover up your left eye and tell me what the lowest line that you can read.
DHJBS.
All right. Okay, go ahead and put it over your right eye, and let's do that again.
DHJBS.
All right. I'm going to take this. Now I'm going to hold this in different areas without moving your head. I want you just to follow along with your eyes. I'm going to go ahead and reset. Okay, now just follow along. Good. Okay, now I'm going to check the strength here. Push against my right hand and then push against my left. Okay. And then I'm going to check your peripheral vision. I'm going to get really close to you. I want you to cover up your right eye. I'm going to cover up my left eye. And then when you see my hand in your periphery, let me know.
No.
Okay.
No. No.
All right, let's go ahead and switch. Cover up your left eye. Okay.
No.
Okay. Hold on.
No. No.
Okay. All right. Now I'm going to have you hold this over your right eye. Go ahead and just look at my face for a couple seconds. Stare straight ahead. Now uncover your eye. Good. Now cover up your left eye. Do the same thing, just stare at me for a couple seconds and then take it down. Good. Okay, I'll take this. Okay, now I'm going to check your hearing. I'm going to hit this, put it against your forehead, and then tell me if you hear it the same in both ears.
Yes.
Okay. Now, I'm going to put it on each side of your head and tell me when the sound stops.
No.
All right, I'm going to do the same thing over here.
No.
Okay. Okay, now I'm going to go ahead and take a look into your ears. I'm going to be looking at your eardrum, make sure that there's no bulging, no redness. Okay, I'm going to go ahead and come around and do on this other side. All right. I'm just going to take a look at your ears, see if there's any lesions or lumps. Is there any tenderness there?
No.
Okay, have you noticed any drainage?
No.
Okay. All right, I'm going to go ahead and take a peek inside your nose. Check for turbulence, symmetry. That side. That side. Okay, have you noticed any draining?
No.
Okay. And then now I'm going to go ahead and take a look inside your mouth. Have you noticed any issues with your teeth, bleeding gums, or any sores or lesions, sore throat? Okay, I'm going to have you open up. Stick out your tongue and say ah.
Oh. Ah.
Okay, move your tongue to the left. Move your tongue to the right. Okay, let me look at the roof of your mouth. All right. Okay. Do you have any questions?
No.
All right, thank you. This concludes my video.